Hello and welcome back to the Legacy Running Podcast. I'm your host, Dr. Sarah, and today I'm so excited to be talking about a concept that is so near and dear to my heart, something that I love helping people fight through, work through, win through, and that's flare-ups of their hip pain and managing it with a rescue plan. I honestly, from a really, really early age as a physical therapist, thought this was just like an everybody thing. Like I thought that this was just like the norm of what people were doing as they were working with clients. And as I've gotten more into the coaching space, it's really something that has helped me with my coaching clients just get amazing results, know how to be in control as they're going through flare-ups and really kind of press on towards their goal and not feel like they're just living in the mental spiral of like, oh my gosh, I have hip pain and this is going to be my life for forever. And two kind of just fun stories that really like kind of maybe solidified this in my mind is I remember doing it wasn't my first internship, it was my third internship as a physical therapy student. And I got accepted to work at this spine clinic. There was a physical therapist that had worked like in the area of where my school was. I went to school in near Phoenix, Arizona. And there was this clinician that came in and we had like a bunch of guest speakers that would come in and would do like different talks on like, musculoskeletal things. She was like a spine expert, or we would have different people that were really interested in like pediatrics or neuro stuff. Different clinicians would come in and like you could get the chance to go if you were interested in those topics. And I was always super interested in the ortho topics. And I remember this physical therapist came in and she talked about the spine, she talked about the neck and the back. And I personally was like shocked. Like I was like, oh my gosh, you are amazing. I actually dealt with like a C5 radiculopathy, which was just kind of like an impingement of my nerve root from the time I was in high school, really genuinely until I saw this specific physical therapist. While I was in grad school, I saw another physical therapist that did jack diddly, did nothing. They did actually nothing because they just didn't know what they were doing. And I saw this physical therapist and she just like changed the game for my neck, for my pain, like for me to just genuinely not be in pain anymore. And it really was because she got to the root cause, but also she gave me flare up and rescue plan strategies, but I'm getting derailed here. As I was working with her and as I worked with her as a patient, I was her patient. She got me amazing results. When I became a student intern, it was time to go on our internships. As physical therapists, we work for like, I don't know, 3-4 different clinics, often for like 3 to 4 months at a time. And you kind of get to like be the clinician, experience it under the like operation of somebody else. I got accepted to work with her. That's long story short. I got accepted to work with her in this spine clinic. And one of the most amazing things that I saw that she did was that she used exercise as like literal medicine with her clients. Like a lot of people that we saw there were, just kind of living a really poor lifestyle. Like they lived in like way lower socioeconomic statuses of like the people around us, kind of in the Phoenix area. They oftentimes were very uneducated, worked very physically demanding jobs, and they would come to see her and they would often have back pain, neck pain, like spine related pain. And she really taught them not just like the power of feeling better with manual therapy and dry needling, all this stuff, but she taught them that they could be in control. Like if you are experiencing pain, let's go to our exercises that we have learned together and let's use that as something that can mitigate the symptoms. And it was always this learning module of like the person would come in, they would get the manual therapy done because she was an amazing manual therapist. They would feel better. They would do their exercises. They would leave. They would feel better. They would go about their day, go about their job, do something, have a lot of pain, be in a lot of pain, not want to do anything because they were in pain. They would come into the clinic the next week. She'd be like, how does this week go? They said, I felt amazing when I left. 3 days later, I did something that aggravated my back. Then I was in pain again. And she was like, well, did you do the exercises that we were talking about? And they were like, no, like, why would I move? I don't want to hurt anything. And she had to walk them through and became me, would walk them through, well, these are a couple things that we have identified feel really, really good for you. Like, you know that you can do these things. You've done them here confidently. You've even felt better after doing them. So let's try them while you're, at home this next week. a couple times throughout the week. And if you are noticing that you're trending towards discomfort, maybe you can try to do these exercises. And then there would be this light bulb that would go off of like, oh, like I love coming in for my manual therapy sessions and I love coming in to learn from you. But like if I do these three things, I feel significantly better and I'm starting to feel in control. And this was like a huge shift for me as really like in a physical therapy mindset of like, oh, my clients can actually be in control and they don't have to like work with me all the time to kind of get out of this. And this is something that I've really taken into like my coaching practice, just to allow my clients to be like, okay, like if I am trending towards discomfort, there are certain things that I could do to do comfortably. So that's number one. That's kind of where I started with this whole like flare up rescue plan idea. And then the second thing, I was talking with another physical therapist who really operates in the coaching space as well. And she was like, I love that you talk about flare ups. Like, I love that you talk about it on your page. She's like, I don't think it's something that we talk about. Like, she's like, I have ankle instability and I've had like multiple ankle injuries. I also have a labral tear. And she's like, for the most part, I do great. Like for the most part, I work out multiple days a week. I'm very active, like just likes to do all of the different activities and sports and all the things. She's like a sports person also with her clientele. And she was like, but I still get flares from time to time. And she recently had a kid and, you know, just the changes of our body that, you know, when we're pregnant and all of those things, it's like your system is not just like this steady thing that's always operating in the same capacity. So she was like, I loved that you talked about that because this is really something that I talk about with my clients. And it just clicked for me that like, okay, number one, maybe this isn't something that's like widely out there. And then number two, like it's awesome that there's another kind of person out there that was like kind of championing, we're just going to pretend that's the word for right now. And was like this, I've also noticed that as I've kind of even said the word flare up and even said the words rescue plan, it's really like offered a lot of comfort for my clients, you know, when they are in those trying times. Because let's be honest, guys, like we have such a big negativity bias. Like think about this, like if one of my favorite podcasters always says this on his podcast, but he says, if you were to walk around and, you know, 10 people were like, oh my gosh, Sarah, I love your shirt. I love your shirt. And then one person came up to you and said, your shirt is ugly. Like, why are you wearing that? That's what you're going to remember. And it's the same thing when we are experiencing increased pain or increased discomfort. You could have been running for like 4 months straight comfortably, and then you get one run and it's bad. And all of a sudden you're like, well, we're done. We're back to square one. This is where we're at. And honestly, like I force my clients, okay, I shouldn't say force. I heavily recommend there's time and space every single week in my programs that you have to share a win. Like every Friday we share wins. Every time we hop on our calls together, I want to hear what a win is because your brain is going to go to the negative spaces and it's going to want you to be like you have accomplished nothing and where you're at now is where you're going to be forever, or you're going to revert back to when you were first in a ton of pain, and it's just not the truth. So as long as you're taking steps out of it, it's just not the truth. So what I really want to go over today is kind of why flare-ups happen and how I like to think about getting my clients out of their flare-ups using their rescue plan. So the first thing that we do, and the first thing that I think is so important that I literally made this like a whole pretty much 3 weeks in my EmpowHER program, is really identifying our aggravators. So I have this cute little sheet and training. It's called the HEAT sheet, and it stands for hip easers, aggravators, and tolerance. And we're really looking at what things make my hip feel better, what things actually aggravate my hip, and what is my true tolerance to running. I share my story all the time in this podcast, but you guys know, like when I first got back to running, I was like going for it. Like I was like 6 miles, 8 miles. Here we go. That's what I used to do. My tolerance was at 20 minutes. Like I could genuinely run for 20 minutes and not experience pain, but I just didn't name it. Like it just would have been nice for someone to be like, Sarah, how much do you think you could actually run? And like, let's just do that. And let's just repeat that instead of like trying to, I don't even know what I was doing, but I was just trying to do what I used to do. And didn't work. So what I really want to do is identify what are your true aggravators. So of course, for my a lot of my clients, they're like, well, running. Okay, great. How much? Like, how much running? Is it speed work? I get that complaint a lot, like that it's really just speed work that bothers their hip. People will come to me literally just to fix their speed work, like genuinely, which and because it's a problem and they want to get faster and they want to get better. So running, duration, speed, intensity, is it frequency? Like how many days per week you can run? Is it like terrain? Like, is it with hills mostly, or is it really uncomfortable on concrete and it's better on like packed gravel? Like, we want to get into the nitty gritty details of these things because we want to actually see the progress that you are going to be able to make over time. And then in this training, and what I'll go through right now is I also offer like what other aggravators are there before I kind of go through just a list of things that are like honestly atypical. Like people are not thinking about these things. I will tell you, I have a client that I finished working with probably a month ago at this point, and she had genuinely like pretty much stopped running frequently because she was like my hip just hurts. Like she was like, I'm afraid because I've done PT, I've gotten back to running, but I'm just afraid to go frequently because my hip is in pain if I do, and I don't know how to stop it. And what we did was we kind of went through this heat sheet principle with her. We built up her running capacity, or I should say, we built up like her running capacity with specific exercise, and then we started slowly added in running. And what we found for her after going through this step-by-step process was she actually her biggest aggravator was her work days. She was like, I have to be in these specific positions at work that really aggravate my hip. And we actually found that she does better when she runs more days throughout the week. She feels better at work and her pain is less when she's actually getting some of that like increased joint lubrication in the morning before she goes to work. And then she's able to be in these prolonged positions. And then on the weekend, we'll toss her for like one kind of mid to long run. And then we just like having more frequency during the week. And she's like, I've never felt better now than, I've never felt better. And it's just so interesting because I think a lot of people assume that running is like the culprit of everything. But for her, we actually found the opposite. And for some of my clients, we really do find that. It's not everyone, but we really do find that they feel better when they're able to run and they're able to be more active over the hip when they have maybe sedentary aggravators. So her aggravator was like just being in these weird prolonged positions. Even though she has a sit stand desk at work, she just was like, I just get so focused and I don't get up and move around. And she's like, I just been there for like 3-4 hours at a time, and I know that really bothers my hip. So other things that can be common aggravators outside of running for some of my clients, another one is maybe not sitting at the desk, like at work or even standing. But like another huge one that I find for my clients is like the positions that they sit in when they're like chilling at night. Genuinely, I can think of two clients off the top of my head. One is like, I always sit playing on the floor with my kids with my knee up to my chest. Like she's like, I just hold it up there and I just do it for like 30 to 40 minutes. And every night I'm in so much pain after, but I've just always done it. So I just keep doing it. Another one was like sitting on the couch in this like slumped position. I can actually think of two clients that had this slumped position. And one specifically has her dog lie on top of her, like and to you, this might be like, that's so, nominal. Like that's not like a problem. But to me, I'm literally thinking of, and I'm not saying that you shouldn't do this, but I'm just thinking of like sitting in that slumped position in a couch is like puts a little bit more pressure on some of the structures of the low back. I'm not even going to name them because I feel like it's going to make people panic, but like it puts some increased pressure on structures of the low back. And I can think of a client that I saw 2 years ago who literally works in a very high intensity job, has had to pass insane physical fitness testing and like could do all of these things, but sitting on the couch was the thing that would make their pain worse. So it's just these little things. Like once you kind of know that it's like being in this posture for this amount of time might be the thing that's bothering me. Okay, how can we mitigate it? And for this client that I'm thinking of, all we did was we just changed some of the positioning of the couch, and then they were able to sit on the couch longer. So it's not like a never thing. That's just the aggravator. It's just so fascinating. Sitting in prolonged positions. Another one is we'll say like ovulation and or menstruation, just the different hormonal changes, the different like kind of structural changes that are happening at that time. Not like static structural changes, but just dynamic structural changes that are happening. It's not atypical that people will have increased pain during those times. Like I said earlier, like increased pain with work week and then decreased pain on the weekend. That could be positional, but could also just be like general stress of like there's a lot more going on during the work week for the most part. Maybe things that are like stressful as opposed to like the weekend might be more like you stressful, which is like positive stress. I mean, still stress, but maybe things that like don't keep you up at night. That is another one. Sleeping on new beds or like soft beds with travel. I have a client, I think I've told the story before on the podcast, but I have a client who would visit her sister in Alaska quite frequently. And every time she would go, she'd have a flare up. And I was like, oh, what's this bed situation? Like, is a soft bed? She's like, so soft, it sucks. It's the worst. It's actually worse, the worst bed. Would always have a flare up, no matter what, every time she was there. So we worked through that. And it was like, oh, I'm traveling in Alaska and I'm, able to, we weren't even going for these longer runs, but it was just so helpful. Like, once we identified that for her to be like, okay, I know what this is and I'm not going to be able to freak out. Long plane rides, just the confined position of like, especially with prolonged periods of sitting is quite uncomfortable for impingement or labral tears, potentially. Stress from travel in general, like we have to think there's so much stress about that. Like, even though it's fun, planes, trains, automobiles, delayed schedules, staying in different places, time change, all this stuff. Like, you just know it can be stressful. Even though it could be the best, it's stressful. Speed work / increasing your pace of running or decreasing your pace of running faster, we'll say, intensity. That is a huge thing that can irritate you. Or like static stretching. Oftentimes, I've gotten this complaint a couple times that people do classes like yoga or like aerial yoga or stuff like that. And sometimes being on that like kind of single leg position for a long time can be another aggravator, or just doing some of the prolonged stretching can be an aggravator. But I'm not saying that these things are bad, and I'm not saying this is a comprehensive list, but I am just saying like it's important to know that like, okay, running can totally be an aggravator, but like, are there other things in your life that are actually an aggravator that are causing you to then show up to your runs and be uncomfortable? And if we just kind of know like, what's your MO? Like, what are the things that cause you to be sore? And if we have a plan or awareness around those things, first we start with awareness, and then we kind of build a plan to like slowly titrate these things back in to the capacity that we need to do. It can be an absolute game changer. So for me, I know my aggravators are often like sitting in a really confined space for long periods of time. Like bleacher seats sometimes can be not like some bleacher seats are fine, but like maybe if I'm like in the middle of the seat of an airplane, I'm like clenching and I'm like, I just in like, I don't know, that's always the worst. Middle seat's always the worst for me. I mean, it's the worst for everybody. And another one is, oh my gosh, I just wrote this out today. I can't think of my other one. Oh, speed work. Speed work. If I'm not prepared for it, like high intensity speed work. I can do prolonged speed work. Like, I don't want to say raw, like not untrained, but like high intensity speed work up a hill can be really challenging for my hip. And I really need to work up to that and like have my strength plan dialed in to do that comfortably. So those are my two things. And it's not that I don't do those things, but it's like I need to be able to build up to speed work. And if I'm going to be sitting on a flight and I'm in the middle seat, I have some things that I could do to like help me unclench and like not become a huge ball of stress as I'm getting off that plane and feeling better. So the first thing to talk about and kind of go over how to manage flare-ups and how to kind of build this rescue plan and the thinking of a rescue plan is number one, we need to identify what our true aggravators are. And that list that I kind of just went through and some of those stories that I just shared are common aggravators for people, maybe things that you wouldn't have thought about. But I would say in general, just really understanding that like having an awareness of what are the things that are going to cause you to be sore is like the best step that we can start with. Like if you just know every time I visit my sister's house and she has that terrible bed, I know that I'm probably going to be a little bit more sore, then you're not going to spiral down this thing of, oh my gosh, I'm never going to be able to run again. so on and so forth. For me, if I know that I'm doing speed work and I didn't build up to that properly, then I just know that I'm asking to be in pain. And it's not that I can never do speed work. It's just that like I know that I need to be on my A game if I'm going to be doing high intensity, short bursts of hill sprints to be able to achieve the speed that I want. So identifying what true aggravators are can be an absolute game changer. That's number one. Okay, number two, if we are trying to really get out of this hip pain and really be able to extend the period in which we feel good, we need to have something to build our capacity. Okay. Like if I am saying that I have hip pain and I want to get back to running, but I'm not really doing anything that is allowing me to increase my body to withstand the demands of running, then nothing is really going to change. So I talk about this a ton on my podcast of the different exercise kind of programming and the different exercise kind of theories and framework that I go through. But at the biggest piece of it, we need to have some sort of consistent program that is going to allow our hip to meet the demands of running. We need to have good enough mobility to go through the demands of running. We need to have good enough stability to go through the demands of running, and we want to have good control, meaning that as I'm doing things that mimic the phases of running, my body is able to coordinate it in a relatively efficient fashion. So if I'm going to do something like a single leg squat, I want to have like my shoulders stacked over my hip and my hips and my hips stacked over my feet. I don't want to be like wobbling all over the place because that's not very efficient. If I'm losing some of that energy transfer by like wobbling all over the place, well, then imagine what's happening as I'm running for 2, 3, 4, 10 miles. I'm having excess recruitment of my muscles to try to stabilize, excess motion at my joints, which can be causing some like grinding or wearing away. It's just more stress on my body. So we need to have that at baseline, enough mobility, stability, and control. Then we want to have those things be able to coordinate for a long period of time. So if we go back to that single leg squat, we want to have maybe 3 sets of 20, great control of single leg squat. So I'm hitting that endurance. Like my muscles and my coordination and my mobility has shown that it's been able to endure for a long period of time without breaking down. That 3 sets of 20 is going to mimic 3 miles of running, 4 miles of running, really whatever it is. Potentially, there's nuance with that, but we need to be able to mimic that. And then from there, I want to be able to work up to true strength. So I want to start to build strength through my muscles with 3 sets of like anywhere from 5 to 12 repetitions at a high enough intensity to actually build strength changes. I'm a huge stickler on like what is the strength kind of parameters, because right now we live in a world where everything is strength. And I don't think that your Orange Theory class is necessarily building strength. And I don't think that your Pilates class is even if it's solid core, I don't think it's necessarily building strength. And I'll stand by that because there's a true definition of what strength is. And if we're doing 3 sets of 2 minutes of a plank, we're not necessarily building strength, we're building muscular endurance, and there's going to be a difference. And we need strength to be runners. And then lastly, we want to have some sort of like plyometric or power training. Like, are we able to jump and land on a single leg and control it? We need to be able to do this. Like, this is what we're doing with running. We at 1/3 of a mile of running is equal to 300 single leg hops. If I asked you to do 300 single leg hops, you would probably take your training more seriously or differently than if you were to do 1/3 of a mile of running, because you're going to imagine that it's more impact with the single leg hops. So we want to use that specific exercise framework that's mine to build capacity so that when we do run, our body is able to withstand the demands and it's not the first time that it's experiencing these demands. The other thing that we're looking at is we want to start to build capacity specifically with running. So I talked about earlier the heat sheet, the hip easers, so what makes it feel better, aggravators, what makes it feel worse, and then tolerance. What's your true tolerance to running? Again, when I got back to running, I literally was like, we're good. I'm back. I'm cleared. 6 to 8 miles. Here we go. Literally flared myself up for 2 weeks, then would do it again, flared myself up for 2 weeks. And finally, I had like this whole moment with myself of like, Sarah, you don't go back to where you were. Like, let's just train. Your tolerance right now is 20 minutes. Let's just repeat that 3 days a week. You'll do your lift and then just go for a quick 20-minute run. Like, lose your ego. I know it sucks. It's not like the loop that you normally do, but just do it. And let's play the long game instead of quick satisfaction. And let's actually get better with this. So we want to identify what our tolerance is and then slowly progress from there. For me, it was 20 minutes 3 times a week. And then I kind of built that up over time to 30 minutes. 40 minutes, 50 minutes, 60 minutes, and then I started to build up my long run. For running, I like to have kind of a structure with this as well, where we're like doing consistent, easy, comfortable runs. So for me, maybe that's 3 times a week at 20 minutes, and then I built it up one run at a time. 2 runs at 20 minutes, one run at 30 minutes. The next week, 2 runs at 30 minutes, one run at 20 minutes, and then kind of build up from there. Again, it's slow, it's consistent, it's steady, it's predictable, but I knew that I wasn't overloading my body by going nice and slow and progressing. And again, I was playing that long game instead of that quick satisfaction. And then from there, once I had those 3 established runs, then I started to build my long run. That was comfortable. And then I started to work into strides, and then I started to work into speed work. So we are looking at increasing our body's capacity by having a hip specific program and then a running specific program. Okay. We'll kind of move on from this step, but that is like, I don't want to just be like, oh yeah, like having flare-ups is a normal part of the plan. And then like that maybe giving you permission to be like, me being in pain is fine. Like, if you're not doing these things, like I think as I'm talking about this, I want it to be stated that we need to be doing something that's building capacity, or we're just going to be in flare-ups all the time. Okay. And there's a difference between having a flare-up and being in pain all the time, which is very markedly different. So the first step, we really want to identify what our aggravators are. So if we are aggravated, we can really pinpoint what it is. Number 2, and this is kind of like maybe like weeks 4 through 9 really of my Empower Hit program is like building that capacity. So weeks 1 through 3, 1 through 4 is kind of really identifying what bothers you, what actually are your aggravators. Weeks like 4 through 9 is really kind of building that capacity, and we kind of throw in how to enact your rescue plan and how to deal with flare-ups. But in that time, as we know what's going on with our flare-ups, we know what our aggravators are, and we know how we're building our capacity, there are just going to be times where load is going to increase, is going to exceed our capacity, okay? Load is going to exceed our capacity, and we are going to have a flare-up for some way, shape, or form. Let me give you an example. So I have a client right now who she works, okay? She works, she's a busy gal, she travels, she does the things, so on and so forth. She very consistently sticks with her running plan. Right now she was, when we first started working together, she was working at about 2 days a week of maybe, 20 minutes of running, but very, very infrequently. So when we first started working together, I was like, okay, let's put you at 2 days a week at like 10 to 15 minutes, and let's just kind of establish what your base is here, okay? From there, we also had her doing those 3 days a week of exercises. So those exercises were building her to, be able to withstand the demands of running. And it looked like something single leg, something rotational, and something plyometric. And as we were doing this, we slowly increased her running load over time, okay? And so her load was slightly exceeding her capacity for those weeks that we were progressing, and she had a great week. She was able to run that first week, let's say 2 by 15 minutes. Perfect. Okay. The next week, maybe we increased 1 15-minute, 1 20, 25-minute run plus the 3 exercises. Amazing. Okay. Go on to the next one. Maybe now we're at 2 by 20 minutes of running. And then we had a flare up, okay? The load markedly exceeded her capacity, and she wasn't able to recover, and therefore she had a flare up. So now we take this time to identify, okay, what is the thing that aggravated you? And let's figure out how we can kind of solve this problem. So we really looked into it, and we were like, okay, like, your weekly exercise plan of what you're doing running wise and strength training wise actually is not superseding what you were doing prior to this program. You were, maybe it's superseding it in the terms of the running stimulus is higher than what you were doing before. But prior to doing this, you were doing cycling, you were doing golf classes, you were doing lifting at the gym, there was some boxing that you were doing. Like there was other exercises that are kind of like a cardio activity that you were doing. So this is actually isn't markedly different. Like for some of my other clients, they've just started running and it is markedly different. And I kind of progress them very slowly, or very, not slowly, but just consciously. I progress all my clients consciously, but for them, I'm just really keeping an eye on. And what we really identified, and she really identified, I can't say that I'm like forcing these things on her, but she really identified was that she had a travel trip for work that week. There was an increased demand of stress. Maybe she was sitting in the middle seat. Probably not, I don't know. But there was an increased work demand of stress. She wasn't able to sleep as well. She had more like, duties and responsibilities that she had to do there. She wasn't able to be as consistent with her exercises that week, but she was very consistent with her running. And it was just kind of this perfect storm of her being sore and not feeling really, really great. And for there, that was step number one. We were able to identify that her load, not just her physical load, but also her mental load had exceeded her capacity. And then now she was in a flare up and she was irritated. She was in pain. She was irritated. So that's number one of like, okay, first of all, for her to identify that this was not just a physical thing, but it was also a mental thing was huge because now she wasn't immediately going to blame her run and she wasn't immediately going to blame her exercise. So she was kind of able to be like, oh, this is like a holistic thing of I'm having increase of pain with not just my running and my exercise, but also like my mental load was higher this week. And when I'm able to get back to my house in wherever, this is going to be a lot better. And that's exactly what happened. As she came home, we were able to kind of enact her rescue plan and she was able to get home and feel a lot better. But I think that story is just awesome to kind of highlight that we need to identify what the aggravators are, so that when she does have an increase in soreness and it is maybe a little bit more mental than physical, she knows that the awareness piece just allows her to kind of stay out of that mental spiral. Okay. Let's go through another example of a client that I have that was a little bit more physical. Okay, so this is my client who we really found that it was the sitting, like the sitting and the just prolonged postures, awkward postures, even though she was standing at work. This was like a huge aggravator for her, and she definitely had more pain on weeks that she was working more. So this client has FAI, so she has impingement into her hip, also has a labral tear into her hip, and she started working with me. She was running very infrequently, 20 minutes, 30 minutes, like just very infrequently because she didn't know what running was doing to her. She just didn't know if it was making her better or worse. So we set her up with her exercise plan. She was doing her exercises 3 times a week. She was really working on stability, mobility, endurance, and plyometric control at the hip. She had 3 exercises that she would do 3 times a week. She was very diligent with doing those and was making marked progress with that. We started her with, I think for her, we did 2 or 3 times a week at 20 minutes. I don't remember. But let's just say we started at 3 times a week at 20 minutes. And she progressed through that for a couple of weeks and was feeling really good. And then there was one week where she maybe progressed to, I don't know, let's say 3 by 30 minutes. And she was like, I'm having so much more soreness this week. And we looked at her week, we identified what it was. We realized that again, her load for her running was exceeding her capacity slightly because that's how we actually want to make change. But we also identified that she had like a huge week at work that week. And she was just she was very concentrated and she was in these long, prolonged positions for such a long period of time that it was like her hip was markedly uncomfortable when she was standing up from these positions. And then she was going home at night and was like in, continued pain with this. So what we did for her was we said 2 things. We said, number 1, we know that you have an increased load at work this week. And honestly, let's just really focus on transitioning from 2 things. Let's focus on transitioning from sit to stand, maybe every hour, every 2 hours, so that it just forces you to be in a different position. And then also 2, let's focus on, that's one option, or every hour, let's set a timer on your phone and just force yourself to get up. Like just get up, walk up, down the stairs, and then come back and sit down and get right back to work. Something to just give that hip joint more lubrication to be able to kind of make it through those sustained periods of dryness for her. That was number one. And then number two, her rescue plan, we enacted her rescue plan. So her rescue plan was a little bit more like mechanical in nature. And we also did this for the other gal, but we found that she responds really, really well to the second person responds really, really well to exercise timing. So that's what we did. We had her really stack her runs during her work week. So we had her do it on like, I don't know, if we had her running 3 times a week, we ensured that she was running like Monday, Thursday. So she was having the most extended, or Monday, Wednesday. So she was having the most extended periods of relief after those runs. And then we also noted for her that she did really, really well with doing her exercises. Like her exercises made her feel really good. So we had her do those on the opposite days. So she would run Monday, Wednesday, Tuesday, Thursday. She would do her exercises in the morning, Tuesday, Thursday, Saturday before she would go to work. So most of the days of the week, she was able to get something in before she went to work. And we found that that really extended her period of time that she was able to feel a lot better and feel less aggravated with her hip pain. And that really worked for her. Okay. For both of these clients, it was really important to me that their exercise plan, when they were flared up, felt doable, achievable, and like in a bite-sized form. One thing I'll say kind of before moving on to here, I just want to kind of put the stake in the claim that flare-ups are going to happen when our load exceeds our capacity, and it's going to be, maybe it is mechanical load, but it can also be like mental and emotional and physical load. Mental and emotional load. We can't like separate those bins because our body is perceiving stress as stress. And that's why it's important to really know and identify what is the bigger bucket here? Is it a little bit more mechanical, as in I ran more and I did faster pace, or is it a little bit more and I need to maybe have a deload week or do more exercises to help? Or is it a little bit more like emotional and psychological and whatever, stressful? And maybe I need to like kind of work on some of those areas in my life to kind of help support that. But just knowing and having awareness is really, really huge in a flare up, because number one, it's going to help with mental. And then number two, it's going to work on where to attack and where to put your kind of action plan in to help you out. So moving on to the last portion of this and how I really like to combat these kind of flare-ups with a rescue plan. For these two clients, it's really important that my clients know, okay, that my flare up or my rescue plan is really bite-sized. It's easy for me to do kind of no matter what setting I'm in, or, really get to it quickly. Okay. So for my first client, actually, let's go for that second client. Second client that really did really, really well with exercise. We kind of put her running on Monday, Wednesday, and then exercises Tuesday, Thursday. She was at a point where she was working on hip endurance, strength, and plyometrics. So let's say she was doing something like a single leg squat with rotation, 3 sets of 8 to 12 at like a 7 to 8 out of 10 rate of perceived effort. So she was working pretty hard with that. She also was doing like kind of skater hops where she was working on like the control at her hip as she was landing plyometrically. And then I think the last thing she was working on was like a hip airplane. So we were working on like stability, and she was doing it without really any support. So we were doing like 3 sets of 15 to 20 endurance, stability, and she was really kind of challenged with those. She felt great with those. I'm going to say with those 2 exercises, specifically single leg squat with rotation and then the hip airplane. Like those 2 things, after she did those, she's like, I just feel so much better. I feel so much more mobile, so much more lubricated. Like my muscles, my glutes, everything just feel on and ready to go. So what I said was like, if you experience this, where like, let's say you've had a crazy day at work, like you did your run in the morning and you had a crazy day at work, you were so locked in. Well, that evening, maybe you just kind of go backwards slightly with your exercises, because if you're going to do the weighted stuff in the morning, you don't need to do that again. But what if you just did a set of the hip airplanes and a set of the single leg squat with rotation, but you just took some of the weight out of it, and you still did like 3 sets of 15. Maybe you did 3 sets of 15 because you're going up you're going down in resistance. 3 sets of 15, and then you did of the single leg squat with rotation, and then you do 3 sets of 20 with the hip airplane, because you know that you always feel better with those things. And that is going to allow you to kind of use your exercise as quote unquote medicine, and allow you to kind of walk out of that increased period of a flare up and not have pain later that night. And then in the morning, when you have to do your exercises, then you can kind of do the full thing where you're doing the hip airplanes and the strength training exercise, and you can, also do that again that day. And that worked really, really well for her. I think we even boiled down her flare up plan to like maybe just the hip airplane, so it wasn't as intense, as she was kind of continuing to do her 3 days a week of like the strength, stability, and endurance stuff. And this can just even get more nuanced as we go, of like, as my clients kind of stop working with me and maybe they're just doing 1 to 2 days a week of strength training, maybe their rescue plan is really easy for them to do like on that third day. And it's easy for them to like implement if they are ever sore. So that worked really, really well for her. The other client that I was telling you about, the one that was really consistent and it was a little bit more mental, and she was having increased flare up because she was, stressed at work in kind of a new bed, and that was uncomfortable. Same thing for her. There still was a little bit, and maybe it was more of like, I'm stressed, I'm not kind of able to do all the things that I need to do. Of course, there's that mental component. Having that awareness is honestly enough. Like, it's enough to stop the spiral and to stop thinking about how much your hip hurts all the time and how you're never going to make progress. So that's number one. She was really able to identify that as she was kind of going through this flare up. We were like texting and kind of going back and forth through this, and she was able to identify that, okay, this is actually a big piece of it. We don't have to blame it on the run potentially, which is fine if we do, like, that's okay. I'm not against that, but she didn't have to blame it on the run. She was able to continue running through the flare up and felt great with it. That was a huge piece. And then the other thing was, oh, okay, like, you are sleeping in a new bed and this is kind of uncomfortable for you. Like, let's take your exercises of where you're at. If they're not super, super challenging, meaning like you're not in those strength dosages, while you're in this flare up, typically I'll have people kind of go back and revert to a slightly easier form of the exercise. I think at this point she was doing like elevated glute bridges and hip airplanes. So we just kept it at those two, and we just had her increase the frequency in which she was doing her exercises from 3 days a week to 4 days a week, and maybe drop them from 3 exercises to 2 on that 4th day. So it felt very bite-sized and simple, and she was able to do that and see a slight improvement of her pain, and then kind of go through her day. And then when she went back to and was able to fly back home, she was able to kind of get back on her schedule, get back on her mental load, and things were feeling a lot better. So all in all, I think the two biggest things that I think of when I'm thinking of there's so many things I'm thinking of when I'm thinking of a rescue plan. But I think the number 3 top things that I think of when I'm thinking of a rescue plan is, number 1, identifying what was the aggravator. Like, for me, I know when I do those uphill sprints, if I haven't like done the work to be able to do that, like if I'm kind of going from easy pace running all the time to like hill sprints, I know I'm going to be flared up. Like, I just know I am. So just identifying that, if I do it anyways, which I actually haven't done that, but knowing that is going to be so helpful for me. If I know that I'm like sitting in the middle seat and I'm like so clenched and I'm like so irritated, and then I get to my destination and I'm like, oh my gosh, my hip is so sore, then it's like, it's just helpful to know that like I'm not falling apart, and it's just, this is an aggravator for me, and like it's okay. Like, I'm going to work through this. Like, just having that piece is so helpful for my clients to identify, oh, I'm ovulating this month, or I'm ovulating right now. Like, I'm menstruating right now. Like, oh, okay, I'm irritated. Like, this is kind of classic for me. It's just huge with the mental. And then number 2 is just identify what exercises typically feel good for you. This is where it's fantastic to work with a physical therapist, to work with a strength coach, to work with a run coach. Really identify like, what are the things, what are the workouts that feel really, really good for you, because we can use exercise to help us feel a lot better. I think there's so many parameters that I like to think of when I'm kind of thinking of what to use with my clients, but I would say the the top things that I think of is like, okay, number one, it can't be random. Like you can't have like seven different things that you do. We need it to be concise and easy, and we need it to be the heavy hitters. For me, it's like side plank and banded back rotations are like the two things that I know are going to decrease my anterior hip pain, decrease my anterior hip pinch. I'm not interested in actually doing anything else because I know that those are my two things. If a new exercise comes out on Instagram and I'm like, wow, that really looks like it's going to target my area, I don't care about it because I know, and I've been in an international flight. I've been seated on the tiniest seat for 4 hours and needed to get up and move around and was in pain that night and needed to do my rescue plan. Like I've needed to do this and I know that it works, and that is like where the money lies. But having 2 to 3 things that feel really, really good for you. And then the last thing is it needs to be like a concentrated enough dosage. It needs to be a concentrated enough pack to actually make an impact. So this is like a great example of like, if I have strep throat and I don't take my antibiotics to the end, your strep throat can actually come back. It can actually be like way worse, like significantly worse than if you just finished taking the full pack of it and like actually killed all of the whatever, the virus. I don't even think it's a virus, but you killed the bacteria to its completion. That's really important. It's the same with the rescue plan exercises. There's so much nuance to this, but it's like if I'm gonna do, for me personally, what feels really good is like I need to get my back and my like glute med activated to like decrease the activation of like my adductor and my obliques and my obturator internus. So I need to turn something on to turn something off. Okay. So I need a high enough stimulus to actually turn this on. So I need to do like 3 sets of 20 or 3 sets of 30 to 45 seconds to actually get enough activation to decrease the like over recruitment of something that I'm feeling that's actually causing me to have increased pain and mechanical compression. And for each of my clients, that specificity is going to look different. But I think it's just important that it's like I'm not just doing 10 reps of a clamshell and hoping that I'm feeling better. Like your clamshell might be a relieving exercise. I can't say, I mean, I can't say I've actually given that to someone as a relieving exercise, but it maybe was like 30 seconds of holding their leg up as opposed to like, 10 reps 3 times, because that I don't even know what that is. Three sets of 10. I don't even understand what that is for a clamshell dosage wise. But having the appropriate amount of stimulus is going to be important to help with that. So in kind of ending and like tying this all up in a bow, flare-ups are a normal part of getting better. I tell this with my clients all the time. As you're like operating and as you're like coming out of acute pain and you're like getting back to your life and you're getting back to, the things that you want to do, it's important that you're progressively titrating in the things that you want, and load needs to slightly increase capacity so that your body can actually increase capacity to be able to handle that load. But sometimes our load is going to increase capacity in ways that we didn't really account for. If it's mechanically, meaning like there's too much loading, or if it's stress and like mentally and emotionally, there's too much loading that way. Like flare-ups are just a normal part of like getting it wrong or being human or like not living in a vacuum where it's like your running tolerance is not separate from your stress tolerance or your sleep tolerance or all those things. And it's just important that we need to identify like what is the thing that is aggravating you, like what are the couple of things that you think are aggravating you, and being able to name it is going to help you understand that you're going to get out of this flare up and you're going to get back to where you're going. The biggest thing that I tell my clients is like progress is never linear. You're going to get better. You're going to take 2 steps up. You're going to kind of drop down off that step, and then you're going to come back to that step you were on once you overcome this flare up, and then you're going to keep going. And the goal is that your flare ups get shorter, and they're also just great information to tell us what actually does bother you. Like for some of my clients, it's more so sleeping on weird beds, as opposed to other ones of my clients, it's more so stress, or other one of my clients are more sensitive to volume changes or speed changes. So progress is never linear. That's number one. Flare up is when our like load increases our capacity and we're not able to recover from it. Number two, we need to have a system to build our capacity. We build our capacity by increasing our ability to handle the demands of running by slowly titrating in running. We also increase our capacity by increasing our hips' ability to handle the demands of running well. Kind of went over that with like my exercise progression today. We can also increase capacity. We can increase capacity so many different ways, but there's different like mental and kind of physical tactics that we can increase capacity that are outside of the scope of this podcast. We can talk about on another podcast. There's so many amazing things we can do. And then the last thing is like, okay, when load does increase capacity, what's your plan? Number one, I think identifying maybe what the aggravator is huge. And then number two, if it is mechanical or like you do respond really well to movement in these times, having kind of that rescue plan of those 2 to 3 things that feel really, really good for you in the appropriate dosage is going to be absolutely huge. And what I will say in like coming up with this rescue plan, like work with somebody on this. I know people who have worked with, I'm thinking of someone who came on the podcast who worked with a strength coach. And like, she was like, I got so strong. And she was like, I got rid of so much of my pain as we started clearing up some of my movement patterns and really working on building strength through the appropriate range of motion. She was like, I made more progress with my strength coach than I ever did working with a physical therapist because I was training at a higher level, meaning that they just kind of understood the demands of running a little bit better than the specific PT that she was going to. Or maybe it is really going to be going to your physical therapist and being like, what do I need to do when I'm in a flare up? Like, what are the exercises that you know that my hip will respond really, really well to? I like really urge you in these circumstances to not just be like throwing spaghetti at the wall because, yeah, you just don't know like maybe you do know what's underlying, but like if you're trying to do a flare up plan, rescue plan, and you're like dealing with bone stress injury, then it's like it could get so much worse. So I think it's always worth it to have someone else create your flare up or your rescue plan in a flare up for you, as opposed to just trialing and erroring all of the random stuff that you see on the interwebs, on the social media. Last thing on this, I have a client who we were working together. We were like probably 2.5 months into working together. And she was like, I just decided that I need to strengthen my back more. And I started adding this like back strengthening exercise in. And I was like, what are you doing? Like, why are you doing that? Like, we don't need to be doing that. I was like, this exercise is strengthening your back. This one's strengthening your back. This one's strengthening your back. You already are strengthening your back. I know that you saw this and it looks flashy and helpful, but like sometimes we could do more harm to ourselves than we can do good. So get help, get guidance, understand what your aggravators are, be building capacity. Don't expect to get better if you're not building capacity. And then number 3, really have something that you can do that's pertinent and curated for you if you are in a flare up to, number 1, feel better. Number 2, stay out of the mental turmoil. And I will say that the flare up plan is a huge thing that we do in the EmpowHER program. It is something that it genuinely takes me 12 weeks plus with my clients to perfect. We start weeks 1 through 4 talking about the heat sheet, identifying what your hip easers, aggravators, and tolerance is, and identifying what those things are. And then we spend the next 4 weeks refining that. Is there anything else that bothers you? Is there anything else that makes you feel sore? We spend weeks 4 through, honestly, 12, but we'll say 9, developing, increasing your capacity with improving your hips tolerance, your body's tolerance to running, and increasing your running progression slowly, specific to you. And then even within that, we practice our rescue plan. I am like, okay, what exercises feel the best for you? We're kind of fine tuning it. And then even as my clients are ending the EmpowHER program and we're kind of in weeks like 9 through 12, we're refining it. Like, do you actually feel really good doing heavy loading? Is that your rescue plan? Or is it really simple mobility exercises that feel really good for you? Like, having this alone, I think, is worth its weight in gold. Like, my clients that are like, I did my feel good exercises or I did my rescue plan and I felt so much better and was able to sit at dinner or travel with my family or go on this work trip. Like, that is huge. So the rescue plan is something that we, in flare-ups, in and of themselves, it's a huge thing we talk about in the EmpowHER program. And I'm excited to say we are actually going to be opening up doors relatively soon. I don't know when you're listening to this, but the January cohort of the EmpowHER program will start mid-January. If you guys are interested, even in the slightest bit, I would look in the show notes, look for the EmpowHER program application. If you fill out that application, it will just let me kind of get to know where you're at in the journey, and it will take you right to my booking calendar. And then from there, it does not lock you into anything. It doesn't cost anything, but we'll hop on a strategy call, see if this program fits for you. There are people that get on and I'm like, girl, no, like this is not it. Like, we need to find you someone in your area that can, physical therapize you. Or for other people, I'm like, yes, like you're such a great fit. I would love to have you in. I'm going to be honest with you. So if you're interested in kind of building your capacity, building your rescue plan, understanding what irritates you, what are your aggravators, and kind of watching the things that you can do and the things that you can do grow and the things that you can't do shrink. Would love to have you apply for the EmpowHER program. The application is in the show notes. And as always, I look forward to our next episode together. If you guys need anything, feel free to reach out to me on socials. I changed my name, so it's the Hip Doc Sarah, on TikTok, Instagram, YouTube, whatever, Facebook, all of the things. I genuinely respond to every message, and it's me. It's nobody else but me. So talk to you guys next time.